Hi, my name is Brad Jones, and this is my presentation for Society and Technology. My presentation is going to be on new antibiotics for antibiotic resistance, which might be a lesser known technological change that's needed in society, and antibiotics definitely have an impact on society. So this is my presentation. All right, so the first antibiotic was penicillin, and that was discovered in 1928. And that changed not only healthcare delivery, but it also changed society a lot. It reduced mortality and morbidity by a lot. I don't have the data on that, but we all can recognize that antibiotics have been important for a long time. So over time, antibiotics were introduced, and new antibiotics were developed to combat different types of pathogens. All the antibiotics have a different mechanism of action of how they kill the bacteria that they're targeted against. So certain antibiotics will target the cell wall, and others will, disrupt DNA synthesis or the plasma membrane or things like that. So over time, with more and more prescriptions for antibiotics, that these organisms that we're trying to fight have developed a resistance to that. So that could be due to overprescribing or poor prescribing habits. For example, some healthcare providers still prescribe antibiotics for a cold, whether they think it might help, or the patient may be demanding that they receive an antibiotic to make them feel better, even when they have a viral infection. And also, patients oftentimes don't follow instructions. They don't use all of the antibiotics when they're supposed to, or they may save some antibiotics for later and start taking them when they don't really need it. And so specifically, we'll talk about methicillin-resistant Staphylococcus aureus, or MRSA, and vancomycin-resistant Enterococcus species, or VRE. These are two clinically relevant resistant types of bacteria. And so the new antibiotics that we'll be talking about a little bit are listed here. I think one of the other reasons why they came up with these new ones was because the old antibiotics were too easy to pronounce, so they had to come up with these ones. So have fun. And so far with these new antibiotics, the studies have been promising, but further research and development is needed. For example, the 2017 review found some flaws. This was published in Clinical Microbiology and Infection by Abbas, Paul, and Huttner. And they found that the previously listed infections had only been studied in non-severe infection. So we still don't know how effective they are in, for example, life-threatening infection. And they were only shown to be non-inferior to the available antibiotics that we have. So they're not necessarily any better than what we're using currently. However, there's still a place for them, as we know that the current antibiotics that we have are probably not going to be effective for that much longer. So even if they're not superior, they will hopefully become superior over time, because the new antibiotics haven't had time to give the organisms time to develop a resistance to it. And then also, none of the previously listed antibiotics had been studied for looking at patient-relevant outcomes such as days of illness, time to return to baseline activity, and admissions to hospital and duration of hospital stay. And also, they're lacking safety data and pharmacokinetic data, so they don't know how it's metabolized, whether that's in the kidneys or the liver, and what kind of adverse outcomes there may be to these new antibiotics. And then additionally, the new antibiotics are very expensive, as you can see in the chart on the right that I made. So some commonly prescribed antibiotics are very cheap. Bactrim, which is prescribed currently for MRSA, is about $3 for a prescription. Keflex, also commonly prescribed, $4.20. Doxycycline, a whopping $11.99. Now, if you were to treat this with delafloxacin, that would cost your patient $1,500, or delbavancin $3,100. So this is just insane right now to be using it, and hopefully the prices will come down as they're more widely utilized. But yeah, as you can see, that's a huge difference, and those prices came from GoodRx.com. And so finally, there's this concept of antibiotic stewardship, which is increasingly important. So it's defined as, and this is a joint definition it's from the Infectious Disease Society of America, Society of Healthcare Epidemiology of America, and the Pediatric Infectious Diseases Society. And they say it's a coordinated interventions designed to improve and measure the appropriate use of antibiotic agents by promoting the selection of the optimal antibiotic drug regimen, including dosing, duration of therapy, and route of administration. So basically, it means don't prescribe antibiotics when it's not needed. If you can test for a specific type of organism that you're trying to treat before administering therapy, do so. For example, if someone's really ill, they would take blood cultures and test their blood, or a throat culture if someone has a sore throat. And then also know your local antibiotic prescribing. So different areas have different localized common infections. And then also this includes educating the patient as well. And so that concludes my presentation. So this is a really important technology, developing new antibiotics as we go into the future, and it has some huge implications for society.